Hi, I'm Dr. Steve Pearlstein, and I'm with the Family Chiropractic Center of Santa Fe. I hope that you've seen What is Chiropractic number 1. This is What is Chiropractic number 2, and we're going to go into a more in-depth look at what chiropractic is. I want to do that by introducing a particular mechanical concept which translates beautifully to biomechanics. In understanding how chiropractic works, that concept is called structure equals function. So what does that actually mean? Well, I'm sitting on a chair, and the chair has a particular function. The chair is a structure, has a particular function. Now, it can be multiple functions. I could use this chair as a chair, as we know it, and I can also use it as a step ladder, a big enough chair I could get under for shelter. So something that's structured in a certain way can have multiple functions. Now, the interesting thing about that concept is that if something is wrong with the structure, then something is wrong with its function. So if I sit down in this chair and it's kind of wobbly, it stands to reason that I'm going to look at the structure to find out why there is dysfunction. And with a chair, it's a mechanical object. I might be able to tighten some screws, and that will make the structure stronger. So I can affect the structure by noticing that there's something wrong with the function, and then correspondingly I can correct the structure, which corrects the function. So how does this translate into the human body? Well, when somebody comes into my office, I operate off that principle, structure equals function. So the structure, particularly for a chiropractor, is any joint in the body, and primarily it relates to the spine. So my examination is going to be really any joint in the body where there's a problem, but primarily the spine. The idea is when somebody comes into my office with pain, that's like the wobbly chair. That is something is dysfunctional. And I look back to the structure to tell me, is there something not right with the structure? Therefore, it is causing something to malfunction. And that's how we use that concept. I've got the spine here, so we'll help illustrate that. Like I said, chiropractic deals with all joints in the body, but primarily the spine. Neck pain, back pain, that kind of thing. Even leg pain usually relates back to the spine. So the spine, in brief, I just want to go over this, is made up of segments, the vertebrae. Made up of segments, and in between each segment, you can't really see it on here probably very well, but there's a disc. And the disc acts like a shock absorber, and it separates the one bone from another. This is very important because housed within this column of bone is the spinal cord, and then the way that the spinal cord communicates with the rest of the body is there's branches from the spinal cord that exit the column. They exit the column in between where two bones line up, one on top of the other, and there's that separation, that space, the disc space. The disc is actually kind of gelatinous. That allows the spine to move, and it also allows there to be breathing room for this nerve root, this branch from the spinal cord, this little guy right here. So, I know how this spine is supposed to work. This is a structure, and it's supposed to have a particular function. So the function of the spine is it moves left to right and forward and backward, and it can turn. There's soft tissues, muscles that attach to the spine, that when they contract or are made shorter, they pull the spine around or they pull it back, and you get all this movement. Only chiropractors think of this. You don't have to think of this. There's also an alignment of the spine. If you look at the side view, there is a natural curvature to the neck, and then this part actually curves back this way, and the bottom part, the lumbar spine, curves in. This is because this column of bone is made stronger. If we imagine it like a spring, there's more of a surface area for gravity to work with, and it's a stronger column than if it was straight up and down. So, that's the structure of the spine, and that's the function of the spine. So here's the interesting part. When a patient comes in with pain, that is a signal, that is an indication that there is dysfunction. Pain is a signal towards dysfunction. And what chiropractors do is we look towards the structure of the human body, primarily the spine, to help us understand why there is the pain, why there is dysfunction. Can there be something that's not working right with the structure? And our examination is designed to determine that. What does happen in the spine is, to put it very simply, these bones can get stuck in abnormal positioning, and then they cannot move as fully as possible. If this goes on for a long period of time, you've got deterioration, degeneration. Misalignment of the spine over time equals deterioration and degeneration. So, when somebody comes in with pain, of course I'm going to take, like any doctor, a history, which will help me determine why there is pain. Where did the pain come from? What started it? Of course, there's obvious answers to that, such as a fall or some sort of traumatic incident. But quite often I see patients, you might be able to relate to this, who come in with pain and they don't really have a true origin for it. They can't really pinpoint what they did. In fact, most people, perhaps most people, come in and say, I don't know what happened, I don't know what I did, I just woke up this morning and I have pain. Well, the examination that chiropractors do is specifically designed to take a look at the structure of the spine, in the same way that, because the chair was wobbly, I looked at the chair. What's not working right with the structure of this chair? So I'm going to determine what's not working right with the structure in the spine. Of course, that goes for any joint in the body, but primarily the spine we're talking about right now. The art of chiropractic is to manipulate the spine in very, very, very specific ways that chiropractors know how to do, and manipulate the spine back to improved function. Manipulate the structure back into improved function. On paper, in an ideal world, an adjustment, which is what the manipulations are called, bring the spine back into proper balance and alignment and function, and the pain goes away. Sometimes it takes time for the pain to go away. Quite often, these structural problems that have led to alterations in proper function have been brewing for a long period of time, possibly haven't gotten past that threshold where there wasn't pain. So those are chronic problems. There are acute problems and chronic problems, and we address them all. So that's at the heart of what chiropractic is, that whole structure equals function issue. Pain can often be seen as a mystery. Why do I have pain? Where did it come from? And by doing a proper chiropractic analysis and looking to the spine for clues, that helps us understand why a person has pain. Now, one thing I kind of left out of the equation, although I did speak about the nerve roots, is the nervous system. There's actually three main systems of the body that we deal with when we're dealing with the spine. The spine is the skeletal system. All of the muscles and ligaments that attached here, that's the muscular system, or muscular system really sets the tone for all soft tissues. And then there's the nervous system. And there is such a close correlation between all three that you really can't isolate one. You can't really say that one is dysfunctional without a corresponding dysfunctional component in the other. And that's really important to understand. So my analysis is always looking at all three as culprits. And I'm interested in how they all relate to each other. One thing to understand, I wish to dispel a myth about chiropractic, and I also wish to explain when we do adjustments, there's often a popping sound. And I know a lot of my patients, a lot of you out there who maybe have not been to a chiropractor, want to know, what is that popping sound? In fact, I have been told, because I've been in practice for 30 years, I've been told numerous times that there's a lot of people who haven't come to a chiropractor because they're afraid. They feel that we're breaking bones. Well, as I've often said to patients, if we were indeed breaking bones, and chiropractic's been around for about 115 years, then either people by and large are absolutely nuts, or there's something going on here and we're not breaking bones. well, we're not breaking bones, folks. In a joint where two bones come together, there is a system of hydraulics, if you will. The way it works, there's pressure and there's gas in the joint. When you take a joint and you rapidly traction it or rapidly pull it apart, if you will, in any direction, if there's an abnormal amount of pressure or gas in the joint, it will suddenly explode out of that joint and make that popping noise. Sometimes a very small noise, sometimes a very loud noise. That's normal. Excuse me, the goal of chiropractic is not the popping noise. The goal of chiropractic is to restore joint function. And in the process, when we do adjustments, invariably, most of the time, gas suddenly and rapidly escapes a joint, and there's that noise. Now, I know there are people out there, plenty of them, in fact, I used to, many, many years ago, pop their own backs and necks. And the reason that people continue to do this is because it feels good. So why does it feel good? And by the way, that's not chiropractic, as I've been alluding to. But why does it feel good? It feels good because when you release the pressure in the joint, it relaxes. It allows the soft tissues, ligaments and connective tissue and muscle to relax a bit. And it takes that pressure off the nervous system and you feel better. But it's short-lived. Studies have shown that you can pop a joint every 20 minutes to some extent. So we're not just popping joints. We're not just technicians who pop joints just to get that short-term relief. No. We analyze the spine to determine why there is pain, where the dysfunction is in the spine, and we actually correct it. The type of adjustments that we do, which are short, rapid thrusts, are designed to take a joint a little bit past its range of motion, and therefore over time, short periods of time hopefully, but some people need longer periods of time, restore the joint mobility, flexibility, and functionality for the long term. The popping is inconsequential. It just occurs. So not only is it not harmful, it is also not really chiropractic, and anyone who has the need to pop or crack their neck or back needs to be seen by a chiropractor to determine what's really going on. Now I want to also address a myth, and this is for people who perhaps have been chiropractic patients for a long time or just sort of know this vernacular. And I'll dispel it right away and then explain it. Bones do not go in and out. I often have patients coming in, patients who've been chiropractic patients for many years with other chiropractors, and they say, "Doc, I want you to put my back in." Or, "You know, last night my back went out." And of course, back's going out, my back went out, that's been around forever, that kind of terminology. And chiropractors fostered that kind of scenario and terminology for many years, way, way back in the beginning of chiropractic. It was a sense that it comes actually from the philosophical foundations of chiropractic, the fact that bones go out of alignment. And it has created an impression that a bone sits in a particular position, and then it somehow miraculously jumps out of that position, causing problems, and chiropractors shove it back into that position. Well, folks, that has absolutely never really been the case. There might be some cases like that when we talk about dislocations of joints, but chiropractors generally are not dealing with dislocations. We're dealing with something called subluxations, which are tiny little dislocations. So bones don't jump in and out, and chiropractors don't put bones in and out. It's very important to understand that. Modern chiropractic recognizes that there is dysfunction in joints and that the adjustments due to particular physiological changes that occur when the adjustment happens restores joint functionality. But bones don't go in and out. Why suddenly is there discomfort or pain? So many patients come in and say, "I've been fine for months, and then suddenly I woke up and there it was." Well, that's a really good question, and it has to do with the condition of the spine. at the time that we're talking about the spine. Injuries from long ago have long-term effects, not always realized at the time or even later. It is generally recognized that it's exceptionally common to have some degree of low back or neck discomfort or pain that comes and goes. Why does it come and go? Because the body learns how to compensate for it. Why does it stick around when it sticks around and gets worse? Because the body loses that ability as time goes on. Because joints tend to degenerate. And when there is a starting point to spine dysfunction and it does not get corrected, then you have a situation where degeneration continues and continues and continues, and things do get worse. Further degeneration just builds on itself, and it becomes harder to restore joint functionality. Although, as a chiropractor for 30 years, I've seen remarkable recoveries from people who had severe degenerative arthritis. Chiropractic treats people in their 90s. I certainly have very successfully. There's nothing to worry about breaking someone's brittle bones, because chiropractors are trained to know how to deal with that. So, I hope on this video that I have answered some questions that you may have had. Of course, I always encourage you to, when you get on the Facebook page, to comment on the video and also let me know what you'd like to hear me talk about, because I'll talk about anything related to chiropractic and subjects close to it. There will be a maybe it won't be a What is Chiropractic Part 3, but I'm going to be talking about topics of health and healing and how it all works, even the doctor-patient relationship. So I hope that you will continue to tune in. There'll be a video. I hope to produce one once a week or once every 2 weeks. And we'll take it from there. Hope you've enjoyed this. I'll see you back here real soon. Thanks.